So in this video, I'm going to show you how to do chest physical therapy with my assistant here, Hello Kitty, and how to clear out her lungs. So let's get started.
Just to recap, there are 18 bronchopulmonary segments, but all 18 segments can be drained by using only 12 positions. So I will be demonstrating all 12 positions right now. Okay, so we're going to begin with her CPT. So first we're going to start with the first areas of the lobe. So we're going to do her anterior apical segments on her right and left upper lobe. So we're going to position her sitting up, leaning back at about 45 degrees, and then area to percuss would be right below her clavicle. So she is leaning already 45 degrees, and we're basically just going to percuss on her apical areas. And we're going to take a deep breath. We're going to put pressure and we're going to vibrate gently. And then she's going to cough up all her secretions. And then we're going to continue on to do her posterior apical segments. So we're going to place a pillow in her front. Patient's going to face this way. We're going to percuss just in the apical area right above her clavicle, scapula. And we're going to take a deep breath, press down, vibrate, and then release, and then she's going to cough up any secretions. Good. And then next we're going to do her anterior segments of the right and lower lobes. So we're going to position her supine with the bed flat. And then areas to percuss is just above the nipple line. So it's going to be right above it. So we're just going to cup right here. We're going to tell her to take a deep breath, press down, vibrate. And then she's going to sit up and cough up her secretions. And then we'll proceed to the next. So then the fourth move would be posterior segment of her left upper lobe. So we're going to position her a quarter away, prone, resting on her right side, and then head of the bed should be elevated 18 inches, so have her head elevated. Use as many pillows as you can so she can lean forward. We're going to cup right here. Technically I should be facing the other way, but same thing. Then we're going to take a deep breath. We're going to vibrate. And then she's going to cough up her secretions. Good. And we're going to do the same thing on her right side. So we're going to position her posterior segment. We're going to do her upper lobe. We're going to turn her a quarter away, prone, resting on her left side. Her right side is up. We're going to cup on her posterior segment. And we're going to tell her to take a deep breath. Then we're going to vibrate. And she's going to get up and cough all her secretions out. Good. So now the next one is to do her left inguinal area, or lingular area. So for this one we're going to do 1/4 turn from supine, from resting on her right side to the foot of the bed elevated 12 inches. So we're going to do a 1/4 turn on her left lingula. So a little space right there. And then area to percuss would just be her left, above her left nipple, under her armpit. So her arm is going to be up.
And you're just gonna percuss on this side. Once you finish percussing for 2 minutes, then we're gonna press down, vibrate. I'm just gonna get up and cough up her secretions. Good. And then next we're gonna do her right middle lobe. So for this position, we're gonna do 1/4 away from her supine with the foot elevated 12 inches. And then the area to percuss is just above the right nipple and under her armpit. So we're gonna go on her left side. We're gonna do the same thing, her arm's gonna go up over her head. Then you're gonna percuss. And she's gonna cough her secretions. Okay. Then the next one will be her anterior basal segments of her right and left lung. So we're gonna start with positioning her supine with the foot of the bed elevated 18 to 20 inches. And then the area to percuss will be her lower ribs. Okay, so her hands are above. So her lower ribs. You do that for 2 minutes. You do the percussion. Then she gets up and coughs. Then we do the same way for the posterior. So we're going to do the posterior segment of her right and left lung. We're going to position her prone with her foot of the bed elevated 18 to 20 inches. Then we're going to percuss over her lower ribs. Then we're going to tell her to take a deep breath and vibrate. And then she can get up and cough. Okay. So the next one would be her left lateral segment of her lower lobes. So we're going to position her on her right side with the right side of the foot of the bed elevated to 18 to 20 inches, and then our area to percuss would be her lower ribs. So use as many pillows as you can. She should be facing this way. So you cup her lower ribs. Tell her to vibrate, or tell her to take a deep breath. Vibrate, and then cough up her secretions. And we're going to do her right side. So get her arm up. And this gets her right lateral segments in her lower lobes. And then take a deep breath, and we vibrate. And she gets up and coughs. Good. And the last one is her superior segments of her right and left lower lobes. So we're going to position her prone with the bed flat area to percuss would just be right below her lower margin of the scapula. So I have like this little pillow. Just gonna go over that. And then I'm gonna cup her lower lobes. Just gonna come up and cough. We can continue if she doesn't have enough secretions coming out. We're gonna vibrate. And I'm just gonna cough again. Okay. That's it.
Remember, position your hands by letting the arms fall to the resting position at your side while standing. The palmar surface of your hand should face toward your thighs. Keep the fingers together and the hands on the resting conformation. So looking at the shape of your hands, they should be like a slightly cup shape, as shown here. By using both hands, work toward a frequency of 50 to 60 percussions per minute. The muscle action is predominantly in the wrist and the forearm, with the wrist acting as a pivot. So observe for red marks on the surface of the skin. Position your patient into all 12 straining positions and identify all the percussions and perform the technique. Of course, observe your patient and any adverse effects during any of these types of procedures. So that basically wraps up our chest physiotherapy review session. So hopefully this helped out. Hello Kitty was a big help, and she had all her secretions removed, so she feels a lot better. So hope this helps.